Kia ora, my name is Laurel. I'm the Clinical Team Leader for Allied Health. Welcome to the Child Health Centre. The Child Health Centre provides a variety of health and disability services to children aged 0 to 16 throughout Northland.
To be honest, we're one of relatively few services around the country at the moment that has a range of child health services under the one roof. So the paediatricians live here and we see kids with medical issues like epilepsy, for example. But I'm sure in your rounds now you'll be meeting the rest of the team. There's a whole bunch of people, physiotherapists, occupational therapists, speech-language therapists, psychologists, social workers.
Hi, I'm Pauline Brown and my job is a clinical nurse specialist in eczema and allergy. I run a nurse-led clinic. I have clinic most days, Monday to Thursday morning, and I see children with moderate to severe eczema from the community, referrals from GPs, Plunket nurses, public health nurses, and of course within our own hospital from the ward and from our paediatricians and nurses.
We have a wider team that goes over to Kaipara, Mid-North and Far North. Our job is really to do home visits to follow up on kids with chronic illnesses, acute illnesses, kids that the paediatricians see. We follow them at home, do lots of liaising.
I'm Megan, I'm one of the psychologists at the Child Health Centre, and we provide a range of services for children and their families. Some of those are assessment services and some of those are therapeutic services, and we cover from the far north through to Welsford.
My name's John Pope. I'm a social worker here at the Child Health Centre. My role is to access services to meet clients' needs.
So my name's Victoria Willett and I'm one of the paediatric dietitians. I'm very lucky in that I get to work both with outpatient clinics here, the Bay of Islands, and we have another paediatric dietitian who does the far north. I also cover SCABU, so our special care baby unit, and Ward 2, seeing children who've been admitted who are unwell and have feeding difficulties.
We're often used as a sounding board. You know, if there are young people out there having difficulties, sometimes people phone us up and say, look, this is the problem, have you got any ideas where we could find services for the children? So we're very broad practitioners, we're very general practitioners. We see everything from small babies with physical illnesses right through to adolescents with all sorts of challenging problems.
So my background is that I'm a nurse that specialised in the field of intellectual disability, and the Behaviour Support Specialist Service here at Child Health Centre provides a service to families and whānau of children and young people with a diagnosis of an intellectual disability. The aims of this service is to provide them with a clearer idea of what their child's trying to communicate, because behaviour is a form of communication. And most importantly, finding ways to help their child still communicate their wants and needs, but in a much more acceptable manner.
I'm Shirley Jackson and I'm the clinic nurse for the Child Centre, but I also have a secondary role in that I do a nurse-led constipation clinic. And so I answer questions on their behalf to families where families have made a request to talk direct to the paediatrician. Sometimes it can just be for something as simple as results, but other times they want to actually say, look, my child's not improving and what can I do?
So physio and VNT, which is the shorter way of saying visiting neurodevelopmental therapy, the referrals, most of our referrals come from paediatricians, some from some of the orthopaedic specialists, some from midwives, but usually paediatricians, because often these babies have had a little bit more interaction with either SCABU or Ward 2 early on. GPs also, as particularly when it's a little bit further down the track and perhaps there haven't been any signs of things being a bit different earlier on.
I also see children who have food allergies. So many children who have eczema also have problems with food allergies, such as milk and eggs and peanuts. So I help diagnose and manage.
Yep, we do a lot of work with our GPs and keep them informed with what we're happening. We certainly work with Plunket and Māori health providers, especially with transitioning those babies over to their care. I love the fact that we have a privilege to go into these people's homes and we can help them with and assist them in maintaining the health of their children in their own homes.
Hi, I'm Martina and I'm the Quality Facilitator for Child Health Services. So I am working with the Special Care Baby Unit, Ward 2 and Child Health Centre down here because we are very keen to hear what people have to say. We are very keen on hearing feedback because otherwise we can't improve what we are currently doing. We are also keen for people to talk to us at the time they experience an incident or for them unfortunate situation. They can also fill in a purple form available at reception, or they can text us, or they can go to the website. And feedback is always welcome.
My name's Louise Kinney and I'm a nurse here at Child Health Centre, and my role is that I coordinate a program for obese children and their families. And so we get referrals from GPs, practice nurses, public health nurses. Families can actually self-refer themselves as long as they meet a criteria. Our multidisciplinary team involves a psychologist, a dietitian, a paediatrician and Sport Northland and myself. And it is a program that runs over a year and involves initially an assessment, and it's not just about the child, it's about the whole family making changes towards a healthier lifestyle. And then we have weekly group sessions, so it's quite neat for these families to be part of other families facing the similar challenges to them.
I'm Alexandra Cave. I'm a speech and language therapist here at Child Health, and there's two of us who provide speech and language therapy services to children throughout Northland for feeding disorders and within Whangarei for communication disorders. And the really nice thing here is that we're all in the same place, so we can talk to the paediatricians or the occupational therapists if they're nearby about our shared patients, and that really works well.
My name's Donna Ray Sheehan and I'm an occupational therapist here at Child Health. So we work with children from 0 to 16 who may have some functional difficulties at home, who may have trouble dressing or moving around the home with the things that they need. We work with children who might be on the autistic spectrum. We take part in that diagnostic clinic here at the centre.
Every family is different, so every family you need to talk to and engage with and access the services as and when the family require them. So when people talk about social work, it can have a negative interpretation, but within the Child Health Service, we're here to help support the families and the families' needs. And I'm happy to answer any question that they may have.
The habits we learn around food as children, well, they become the habits that we know as adults and are a lot harder to change. So we get the benefit of being able to help children and their parents, or their whānau, make lifestyle changes that will set them up to be really, really healthy adults. Things like a good breakfast, which means you can go to school and you can learn, which sets you up with a good education, and then you can find a good job. All of those things impact health far more than just the immediate picture that we can often see as well.
Whereas, of course, children, especially when there's some limiting factor, don't have all that choice. And so I guess we get to try and optimise function, reduce barriers, and make sure that kids are out there participating in, swimming or early childhood education, or and generally that families have got the knowledge and the skills that they need to help their child develop just as all of us would.
What we do with the families is encourage them to set SMART goals. So SMART goals are specific, measurable, achievable, realistic, and have a time frame to them. So those goals are not weight-related goals at all, they're lifestyle-related goals. So it might be something small like making water the only drink in the house, water or low-fat milk.
I mean, we talk about immunisation as being one of the most important advances in public health and in medicine. If you can't understand the benefits versus the risks of immunisation, then you won't understand anything else in medicine. It is very effective, very safe, really important. And as you point out, the important thing is not just to be immunised, but to get these consultations done on time. The timing is really important for the early ones.
So there's a lot of parenting advice mixed with some good old physiotherapy, which fortunately with kids is mainly about play. So we get to, instead of heat packs, I've got bean bags and cars and planes and scarves. And I guess the big thing about the difference between maybe physiotherapy traditionally provided to adult services and those in paediatric services is that we work really closely with our speech language therapy colleagues and our occupational therapy colleagues, the dietitians, everybody really. And that's the really good thing about child health, is that we're all here together.
We have a real open door policy here at Child Health Centre, and it really is a knock on the door and pick each other's brains. But we also really, really work hard to optimise the patient's journey and not create barriers. So we talk to one another about how we can make things easier for families.
I think one of the advantages of the Child Health Centre is it's a very friendly place. We're not part of the hospital, and I think a lot of families have said to us over the years that it's really quite nice to come with somewhere that's not a hospital outpatients. So it's a very family and child friendly place, and we have great respect for all of those children and families who come through our door, irrespective of their ethnicity.
It's around working together to make the journey as smooth and as simple as possible, because things are already a bit more difficult for that family.
So yes, it's been a happy place over the years, and I hope it continues that way.